Have you ever thought that something as basic as personal hygiene could be sending silent signals about your internal health? Most people don't, but doctors do. In fact, experienced physicians can often spot serious medical problems just by noticing small hygiene mistakes in their older patients. And here's the part that many find shocking. Most seniors have no idea they're doing anything wrong. These small errors may seem harmless, even normal, but they can quietly reveal the early stages of conditions like heart disease, kidney issues, or even dementia. Today, we're going to walk through 7 of the most common personal hygiene mistakes that doctors notice right away. And more importantly, I'll show you exactly how to fix them. Because these aren't just grooming tips. These are signs your body may be asking for help. Let me tell you about Carl, a 74-year-old retired high school coach. Carl considered himself active and independent. He walked every morning, kept up with his lawn work, and still played cards with friends on the weekends. But during a routine checkup, his doctor noticed 2 unusual things: his nails and his skin. That quick observation led to early detection of a circulatory condition that could have become life-threatening if left untreated. I never would have guessed. Carl told me later, "It's scary to think how close I came to missing it completely." So stay with me, because what you're about to learn could help you or someone you love stay healthy, independent, and possibly even live longer. And if this topic matters to you, take a moment to hit the like button, share this video with a friend over 60, and subscribe for more practical, life-saving tips for aging. Well, mistake 1. Neglecting oral hygiene. When was the last time you truly paid attention to your oral care routine? Not just brushing out of habit, but really thinking about what your mouth might be telling you? Take a moment. Have you checked the state of your toothbrush lately? Is it soft, worn out, or even overdue for replacement? Are you brushing long enough and consistently? Most people assume that dental care is all about avoiding cavities or bad breath. But here's what many don't realize. Neglecting your mouth can lead to far more serious consequences. Medical researchers have found clear links between poor oral hygiene and major health conditions like heart disease, stroke, and even cognitive decline. How does this happen? When you let gum disease fester, often through bleeding gums, inflammation, or poor brushing technique, harmful bacteria can enter your bloodstream. From there, they may travel to your heart and other organs, quietly doing damage before you even feel symptoms. Let me tell you about Helen, a 71-year-old widow from New Jersey. She brushed her teeth every morning, but often skipped evenings and rarely flossed. For months, she noticed a little bleeding when brushing, but dismissed it as part of aging. "I thought maybe my gums were just sensitive," she said. At her next checkup, her doctor spotted signs of chronic gum inflammation and referred her to a cardiologist. Tests revealed that Helen had early signs of a heart condition directly related to oral bacteria. Thankfully, they caught it in time. But had she waited just a few more months, the damage could have become permanent. So what should you do right now? Start by replacing your toothbrush if it's older than 3 months or sooner, if the bristles are frayed. Switch to an electric toothbrush if possible. Studies show they remove significantly more plaque than manual ones. Brush twice a day for at least 2 minutes. And floss every single night without fail. Yes, every night. Don't skip dental checkups even if you have dentures. Pay close attention to your gums. Are they bleeding, swollen, or tender? These aren't just signs of getting older. They're warnings your body is giving you. Will you take them seriously, or wait until it's too late? Mistake 2. Infrequent bathing and skincare. Let me ask you something simple but important. How often are you bathing these days? Many older adults quietly reduce their bathing routine as they get older. It might be because of joint pain, a fear of slipping, or just feeling like it isn't necessary anymore. But here's what many people don't realize. Your skin isn't just something you clean. It's your body's largest organ, and it can tell you when something inside isn't quite right. In fact, changes in your skin, its color, texture, or even dryness are sometimes the first signs of deeper medical issues like diabetes, liver stress, or heart trouble. And if bathing becomes less frequent, those signs can go unnoticed for weeks or even months. This was exactly the case for Norman, a 78-year-old retired mechanic from Ohio. During the colder months, he began limiting his showers to once a week. "I just didn't want to make my skin drier," he said. It seemed harmless, he wasn't getting dirty, and he wasn't around many people. But during a checkup for a completely unrelated issue, his doctor noticed strange blotches on Norman's back and legs. What seemed like simple skin discoloration turned out to be one of the first signs of early-stage kidney dysfunction. The issue wasn't that Norman was dirty. It was that infrequent bathing had delayed the chance to catch something dangerous. By bathing less, he had unknowingly hidden one of the only outward signs his body was giving him. So what should you do instead? First, aim to bathe at least 3 times a week, even if you're not sweating or leaving the house much. Use a gentle, fragrance-free soap to avoid stripping your skin's natural oils. After bathing, apply moisturizer while your skin is still slightly damp. This helps seal in hydration and protect your skin barrier. And don't forget, the most important step, observation. Look at your skin. Are there any unusual patches, persistent itching, changes in color or sensitivity? These might not just be surface-level issues. They could be messages your body is trying to send you. Will you listen before it's too late? Mistake 3. Ignoring nail care. Let's take a moment to talk about something that often gets overlooked: your nails. When was the last time you really examined them? Not just trimming for appearance, but actually checking the color, the texture, the thickness. Are they clean underneath? Do they feel strong or brittle and dry? You might not think much about your fingernails or toenails. Doctor do. That's because your nails can act as a window into what's happening inside your body. Subtle changes in your nails can be early signs of deeper problems, things like anemia, liver dysfunction, thyroid imbalance, or even heart disease. According to research from the American Academy of Dermatology, nail abnormalities in seniors over 65 have led to the diagnosis of hidden internal conditions in nearly 1 out of every 3 cases. That's not a small number. It means that ignoring your nails might mean missing your body's first quiet cry for help. Take Irene, for example. She's an 81-year-old retired librarian from Pennsylvania. For months, Irene noticed her toenails getting thicker and changing color. She chalked it up to aging, started wearing only closed shoes, and avoided discussing it. "I didn't think it was important," she told her daughter, but when she finally visited a foot specialist after developing pain while walking, the doctor diagnosed a fungal infection that had been left untreated for too long. Further testing revealed Irene had a suppressed immune system, a condition that needed immediate care. That minor nail issue turned out to be a major health clue. So what can you do? Start by trimming your nails regularly, straight across with slightly rounded edges, to avoid painful ingrown nails. Keep your nails clean and dry. Change your socks daily. Choose breathable footwear that gives your toes room. Most importantly, don't ignore what your nails might be telling you. Are they thickening, turning yellow, peeling, or developing ridges? These changes are not simply cosmetic. They're messages from your body asking you to pay attention. Will you listen to those signs before they become something more serious? Mistake 4. Improper incontinence management. Of all the hygiene issues that come with aging, this might be the most quietly damaging and the most often hidden. Incontinence is far more common than many people think. In fact, over half of older adults experience some form of it. But what makes it truly dangerous isn't the leakage itself, it's the shame that keeps people from speaking up. Instead of seeking help, many seniors try to manage it in silence. They improvise, they use paper towels, or wear multiple layers of clothing. They adjust their routines, avoid outings, and try to stay close to a restroom. But what they don't realize is that ignoring incontinence can lead to serious health consequences. Doctors from several major medical centers, including Johns Hopkins, report that untreated bladder issues can result in skin breakdown, painful infections, dangerous falls, and even delay the diagnosis of serious conditions like bladder or prostate cancer. Their data shows that seniors who actively manage their incontinence have far fewer complications, up to 60% less, compared to those who don't seek support. Take Walter, for example, a 74-year-old retired bus driver from Indiana. For nearly a year, Walter experienced light leakage but kept it to himself. He felt embarrassed, even weak. I didn't want anyone to think I couldn't control myself anymore. He said he used tissues, changed his clothes frequently, and told no one, not even his doctor. By the time Walter sought medical advice, he had already developed painful sores and recurring skin infections. Further tests revealed a condition affecting his prostate that could have been managed far more easily if caught months earlier. So what can you do if you or someone you love is going through this? First, let go of the shame. Bladder issues are medical, not moral. Talk to your doctor. They see this every single day. Use products specifically designed for incontinence, not improvised ones. Change immediately after any accident and follow a gentle cleansing routine to protect your skin. And please don't assume this is just a normal part of aging. Frequent age, urgency, or planning your day around bathroom access may be your body's way of asking for help. Will you listen before it becomes something more serious? Mistake 5. Ear higgina errors. Let's talk about something many people do without even thinking: cleaning their ears. What's your usual method? Be honest. Do you use cotton swabs and push them deep inside? If so, you're not alone, but you could be making a dangerous mistake. Many older adults believe they're keeping their ears clean, when in fact, they're damaging the very structure that allows them to hear. Otolaryngologists, ear, nose, and throat doctors have warned that improper ear cleaning is one of the leading causes of preventable ear injuries in seniors. In fact, studies show that nearly 40% of ear canal injuries in people over 65 are caused by incorrect at-home cleaning methods. These injuries often result in painful infections, hearing loss, and permanent damage, all of which could have been avoided. Let me tell you about Elaine, a 72-year-old retired piano teacher from Oregon. Elaine had cleaned her ears the same way for decades, using cotton swabs after every shower. One day, while cleaning a little deeper than usual, she felt a sudden sharp pain. She had accidentally punctured her eardrum. The infection that followed spread quickly to nearby tissue. Elaine required emergency treatment and now lives with partial hearing loss in one ear. I honestly thought I was doing the right thing, she said. No one ever told me it was harmful. So how should you clean your ears safely? There's a simple rule: never insert anything smaller than your elbow into your ear canal. In other words, nothing should go inside your ear. Use a warm, damp washcloth to gently wipe the outer ear only. If you feel like you have too much earwax, use over-the-counter eardrops made to soften wax, but always follow the instructions carefully. And if you experience pain, unusual discharge, or sudden changes in your hearing, don't guess. See a doctor immediately. Are your ears itchy? Do they feel blocked or full? Have you noticed any changes in your hearing lately? Don't try to fix these problems yourself. Your hearing is incredibly valuable. Protect it with proper care. Mistake 6. Poor foot hygiene. When was the last time you really examined your feet? Not just a quick glance, but a careful check between your toes, along your heels, under your soles. Many older adults stop paying attention to their feet until something hurts. But by that point, the body may have already been sending silent warnings for months. Doctors who specialize in elderly care say the feet are often the first place they look for signs of hidden conditions like diabetes, poor circulation, or nerve damage. According to the American Geriatric Foot Health Association, over 80% of serious foot-related complications in seniors could be caught early and even prevented with proper foot hygiene and regular inspections. That is not an exaggeration. Something as simple as dry, cracked skin, or a persistent sore can be the body's way of crying for help. Let me tell you about Walter, a 74-year-old retired school janitor from Georgia. Walter always wore socks around the house and avoided showing his feet even to himself. I thought it was just dryness or age spots, he recalled. But when a nurse noticed unusual darkening on one foot during a home visit, they ran tests that revealed severe circulation issues tied to early-stage diabetes. I didn't even feel the cold in my toes anymore, he said. Early intervention allowed him to avoid surgery and possibly saved his foot. So what should you do starting today? First, wash and dry your feet thoroughly every single day, especially between the toes. Use a soft towel and take your time. Inspect for cuts, swelling, blisters, or patches of discoloration. Wear clean socks made from breathable, natural or moisture-wicking fibers, and never stay in damp socks for long. Moisturize dry areas daily, but avoid applying lotion between your toes, where moisture can cause fungal infections. And if you notice numbness, tingling, or sores that don't heal, do not wait. These could be symptoms of something far more serious. Talk to your doctor immediately. Are your feet dry and cracking more often? Do you feel a burning or cold sensation in your toes? Is there a sore that hasn't healed in weeks? These are not minor cosmetic issues. They are your body's whispers, and if ignored, they may one day scream. Mistake 7. Medication-related hygiene issues. Are you currently taking more than one medication each day? Have you noticed subtle changes in how your body smells, how much you sweat, or how dry your mouth feels? You might not connect these symptoms to your prescriptions, but sometimes the medications that are helping your heart, your blood pressure, or your mood may also be creating silent issues that show up in your hygiene. According to the American Center for Senior Pharmacology, some of the most common side effects in older adults involve the skin, mouth, sweat glands, and body odor. Their studies reveal that up to 40% of medication-related complications in seniors first appear as personal hygiene changes long before more dangerous symptoms begin. Let me tell you about Joanne, a 69-year-old retired piano teacher from Oregon. She took pride in her daily routine: clean clothes, gentle soap, minty toothpaste. But her daughter began to notice a persistent, strange odor that didn't go away, even after showers. At first, they thought it was just normal aging. But when Joanne's doctor looked deeper, he discovered that one of her medications was placing too much stress on her liver, causing metabolic changes that altered her body's chemistry and her scent. The fix: adjusting the dose and supporting her liver health before serious damage occurred. So what can you do? Start by tracking your hygiene. Keep a simple notebook near your bathroom or nightstand. Write down if you notice new or stronger body odor, sweating when you're not exerting yourself, dry mouth that makes it hard to swallow or speak, skin rashes, or changes after a new prescription. Stay hydrated unless your doctor advises otherwise. And never skip meals when taking medication that affects metabolism. Most importantly, do not adjust or stop medications on your own. Instead, bring your notes to your doctor and have an honest conversation. They may spot patterns you can't see. Are you brushing, bathing, and doing everything right but still noticing something off? Sometimes, your body isn't just reacting to the outside world, it's sending signals from within. Are you listening? Now that you've discovered the 7 hygiene mistakes that doctors instantly recognize in older adults, you hold a powerful key to better health. These may seem like small habits, but correcting them today could protect your independence, prevent serious illness, and even extend your life. Good hygiene isn't just about looking presentable, it's about listening to your body and honoring it with care and attention. The earlier you act, the more control you have over your health journey. Has your doctor ever mentioned any of these issues? What changes are you planning to make starting today? I'd love to hear your thoughts. Leave a comment below and join the conversation. And if you found this helpful, please give this video a thumbs up, subscribe, and turn on the notification bell so you won't miss more life-saving advice like this. Finally, if someone you love is over 60, please share this video with them. Your small action today might make a big difference in someone's tomorrow.